Hello again. In this video lecture, we're going to be talking about coding ICD-10 PCS procedures to deal with poisoning and other external causes besides injuries. And the procedures that we are going to cover in this short video lecture are talking about poisoning and other things. And again, when you read the procedure note or the op report, you want to look at what's the intent of the procedure. For instance, if we're doing something to expand or dilate a vessel like an angioplasty, we're going to be wanting to code the root operation as dilation. Extirpation is removing a foreign body. And again, these are not only in your text, but they're in your PCS code book. Look at the appendixes and see if you can find some examples of these. The other thing that we do is to insert something that's a non-biological device. We replace things. We replace a body part. We remove things. We can remove pacemakers and what have you. And we can also revise things if something is not working correctly. We can also transplant organs. We commonly think of these as hearts, but there are also many other organ transplants we can do, including corneas. Hemodialysis and renal replacement therapy is performed with patients, and the diagnoses in this chapter happen when the patient is in renal failure. So basically, with these procedures, what we're doing is filtering the blood and making urine. And we can do this in a few different ways. We can do intermittent hemodialysis, which is what most people think of when somebody's coming in 3 days a week to a dialysis center for a few hours. This is code 5A1D70Z, intermittent hemodialysis. We can also have prolonged intermittent renal replacement therapy, the PERT as it's sometimes referred to, PIRTT. And this is 5A1D807, so a different character. Let's take a little look at what some of these things mean. So as we can see here, the difference between the two, the 7 in 51D70Z is for intermittent. 5A1D80Z is prolonged intermittent. And then the continuous is 5A1D0Z. And that's all I have for you. We'll see you online. Bye now.